Hi, and welcome to What I Wish I Knew Before Breastfeeding. My name is Andy Schwartz. I'm a registered dietitian, I'm a certified lactation counselor, and I'm a happy baby expert for Happy Family Organics. And I'm so happy to be here. It's actually my second time with the expo, the Prego Expo, so I'm really happy to be back. And what I'm gonna really focus on is just sharing my journey, but also sharing what in our happy family chat that we experience with a lot of new moms and things that sort of evolved through their breastfeeding that if maybe beforehand they knew or had a little more information or just even more tips really to kind of troubleshoot things that their breastfeeding journey could have been a little different. So I am a mother to a 7-year-old and now 6-year-old, but not too long ago, I was in the same shoes as you, pregnant, wanting to breastfeed, wanting to learn about breastfeeding, and really not having much firsthand experience in watching breastfeeding. So that was a little bit of a challenge. I had no idea what to expect. And somehow I think I thought that it was just going to be so intuitive and natural and wouldn't really be a hard thing to try because it is, kind of something that we're born to do, most of us. And what I found was with my first son, so my 7-year-old, that he just was really not satisfied when we would nurse. And I was nursing frequently. I did take a breastfeeding class, which taught me a lot of things about nursing frequently and things I'll share. But I thought I was doing everything right and that I was supposed to be doing. And I mean, he was latching. It wasn't like he wasn't latching, but he just wasn't seeming satisfied. And he would be crying and just so upset. And it was so disheartening for me because I was just such a committed breastfeeder that I didn't know what I was doing wrong. So what I did learn, and by the way, it did work out fine. We ended up breastfeeding for about 15 months, but I just knew again, something wasn't quite right as about him being dissatisfied after our feedings. And he was gaining weight okay, but he wasn't gaining a lot of weight. Breastfeeding babies do gain weight differently, but something was just a little off. So again, my intuition and just watching my child gave me the initiative to reach out to a lactation counselor. And she was such a big help to me. And that's one of the reasons why I'm here today, because I felt that without her and without the support that I received, that I may have, I guess, not trusted or not thought that my body or that I was able to breastfeed because my baby just wasn't seeming to be happy. And number one, babies and newborns can act like that no matter what. You could have a lot of milk. You could have very ample milk supply. But depending on the latch, depending on the baby's temperament, depending on so many factors, the delivery, of course, a C-section versus a vaginal delivery, there can be so many different elements that can affect how your baby may respond when you're breastfeeding. So it's not always a clear tail answer that if my baby's fussy, that means something's wrong with my milk, or that means something's wrong with the latch. But what it does tell us is that we do need to explore and we do need to keep kind of troubleshooting on what could be going on. So again, with my story that I shared, what it was is that my son had a little bit of a tongue tie. It wasn't severe. He was able to nurse and latch, as I mentioned, but he just wasn't able to efficiently remove the milk. So that I think he was just getting very fatigued, very cranky, very tired. And it just was putting a lot of stress, on myself and him. So what we did, the pediatrician, of course, I went right to the pediatrician and the lactation consultant after him. But first the pediatrician and shared, and he did look at the baby's tongue. And there's different tips that we can share on our chat too, how you can actually check your baby. But just kind of knowing that there's different things in the anatomy of each baby, there's different things, tongue and lip tie are common. But once that tongue tie, and it was, again, an in-office procedure, not even a laser, nothing big at all, just kind of snipped a few little pieces there. And he was then on his way to nursing, as I said, for 15 months. So again, my tip is really when you start breastfeeding and you do find that something does not quite seem right, or that the baby just seems fussy to the point where, it just can't stop crying, then that can be maybe a sign that you need help. And then reaching out to your pediatrician, reaching out to lactation counselor if you have one. Also, a good tip is to know lactation counselor to go with before. So I had one in my class. I was taking pregnancy, kind of birthing method classes beforehand. And she was a lactation counselor. And so she helped me as well when I was nervous and asking like, why is he acting this way? What am I doing? But, you know, these days with the, that was 7 years ago. Now there's so much more remote help. And obviously with COVID, there's a lot more remote help too. So just reach out for sure if you do need some assistance, and, you know, even just reassurance to know that, okay, everything's going okay. Some pediatricians aren't as breastfeeding savvy. So if you find that's important to you, then maybe looking around for a pediatrician that you feel might really support the breastfeeding and really have a good understanding, or again, have a lactation counselor, lactation support that you can go to as well. Okay, so now let's get into the nitty-gritty on really some other things to learn or to know, kind of educating yourself early on about breastfeeding that maybe aren't kind of common knowledge or not as, you know, talked about, I guess. So when I was first starting to nurse, I thought, okay, so we'll nurse, you know, when the baby is asking. You know, again, I shared with you that he was asking all the time for a period of time. But actually the first 3 days of our delivery, he just slept. We had a very hard delivery. It was around 36 hours. That's not normal, so don't panic. It's not that every delivery is going to take that long. It was a vaginal delivery, but he was reverse, so his head was coming out, you know, face up instead of the back of the head, which makes the baby slide out much easier. So it was a natural delivery, but just long and very tiresome for him. So all he wanted to do, like the first 48, 72 hours, was sleep. So I'm thinking, well, I'm tired too, I need to sleep. And that actually turned out to be a real issue because my milk did not come in until about 5 days, about 5 days after delivery, which is certainly on the longer side. Usually your mature milk, which is the white milk that we kind of think of what breastfeeding is, does not come in until about 2 to 5 days after delivery. And that doesn't really change if you had a C-section or a vaginal delivery. Either way, it's going to be about 2 to 5 days. Some do say with a C-section, it could be on a little bit on the longer side, maybe the 3 to 5. But generally speaking, that's when the mature milk is going to come in. So let's say your baby's having trouble latching and you're pumping and you're not seeing that white milk come through. You're not seeing like an ounce even of milk come through in the bottle of the pump. That does not mean that you're not making the proper milk. That just means that your body has not transitioned into the mature white milk. The colostrum, which is the droplets or the drops of milk that our body still first produces after delivery, is at that 2 to 5 days. So you could be totally normal and not producing, you know, ounces or bottlefuls of milk, and your baby doesn't actually need that much milk those first few days. The first day, your baby's stomach is the size of a cherry. So think of how small that is, right? So look at cherry, like so tiny. That's the size of the baby's stomach. So that is a perfect, nature knew that the droplets of the colostrum was exactly what the baby needed because that's the size of their stomach. So you still want to keep that in mind as far as volume and how much my baby needs. It's not kind of those big bottlefuls that we think lots of times. It definitely changes as the baby develops. Day 3, it's about the size of a walnut. And if you wanted to kind of just have a volume associated, like how much actually that is, the cherry is 1/2 to 1.5 teaspoons. So that is very little. The walnut, so day 3, approximately, still colostrum here, it would be about 1 teaspoon to 1/2 ounce. And then after the first week, now we're starting to get into where it would be more into the ounce because again, our body has now transitioned to the mature milk. So it's not those colostrum droplets. It's now the actual kind of more like liquid, watery versus that dense, thick colostrum. So now in week 1, it's about the size of an apricot and now about 1 to 2 ounces. So you may start to see now you're pumping 1 to 2 ounces. And you don't need to pump right away, by the way. I'm just mentioning that if the baby was having trouble latching, if the baby was preterm, like a preemie in the NICU, or any feeding issues where you'd have to pump early on. Typically, though, I do advise trying to nurse at the breast before pumping so that, A, you have, you know, the milk there for the infant, and also that, you know, unless there's a reason to pump, kind of don't pump right away if possible, and just focus really on improving the nursing and having the baby at the breast, which ties into the next tip I wanted to share, and that's about the skin to skin. So pumping does not, interestingly, produce as much milk as nursing on the breast. And that's because when your baby rather is nursing, it's actually all that stimulation. It's the smell of the infant. It's the touching of the infant. It's the visual. It's all those senses that actually signal from our body to our brain to produce different breastfeeding hormones like prolactin that actually help release and produce our milk, our breast milk. So there's a lot of benefit in that skin to skin, especially within that first hour post delivery. And then, as I mentioned, my baby kept sleeping and I wasn't getting that skin to skin. So that really delayed my milk coming in, as well as, of course, him being tongue tied. So see, there's all kinds of different factors that can come into play on why things happen. But trying to trust in your body, knowing that, our bodies were made to breastfeed. I know different moms have different challenges, but really our bodies were meant to do this. And with the right support and with just the right knowledge, we can troubleshoot and typically find a way to have the breastfeeding be successful. It may not be successful day one. It may not be successful even the second week. But as long as we are continually sort of troubleshooting and trying and not being impatient, which I know is really hard, and anxious. I was super anxious about what was happening, but I just kept trying to, take deep breaths, reach out to my family, reach out to my sister who had breastfed, the lactation counselor, anyone that can kind of give me that support. That's a big reason why I chose to work with a chat, because that's what we do to support the moms. It's a free chat service on Happy Family Organic. So there's so many ways we can do this. It's just having that knowledge, knowing that there can be things that come into play to kind of interfere sometimes, or at least slow down the process of being successful. But it can be possible for most women. So kind of going back to how much, the frequency thing, by week 2 or so, we're going to about 3 ounces. And then by 1 to 6 months, now we're going to about 3 to 4 ounces. So again, a lot of moms like, wow, that's it, 3 to 4 ounces. And yeah, usually that's all the baby needs up until 6 months, into when they start doing complementary foods. Now, some moms may produce more milk, and there's formulas that we share with moms if you're going to be going back to work, or someone's going to be giving the bottle, on exactly how many ounces per bottle per feeding per day. But generally, if you're nursing at the breast, you don't need to measure all this. It just kind of gives you an idea of the developmental from day 1 all the way to 6 months on how much milk the baby needs and how much milk your body's actually producing. And again, that was super fascinating for me, because in my head, I thought I was going to be producing like those bottlefuls of milk. And I'm thinking like, why am I not producing this much? And again, that was just not how our bodies or breastfeeding is supposed to go. It goes in that slower transition phase versus like just coming right out of the delivery room and filling up bottles, from pumping. So hopefully that makes you feel a little better that your body likely is doing what it needs to do. It's just a time for it to, and the baby to develop into more milk down these weeks and months ahead. But as far as number and frequency, we want to nurse and offer the baby the breast on demand. And by doing so, especially the small, like half teaspoon, a teaspoon, by doing that maybe 10, 12, could be more than 12 times per day when they're really young, then that frequency in that small amounts will provide them the right hydration and the right nutrition that their body needs to continue to grow and continue to thrive. So it's not that we just provide that small amount, 6 times. Sometimes moms think, 6 to 8 times is sufficient. Really, it's on demand. So the baby should let us know how much it needs based on its hunger cues, which hopefully I have time. I think I do have time. I think I have time to talk about the hunger cues, but using the hunger cues as your guide for the on demand. If you're bottle feeding, or again, if you're in the NICU, totally different situation. But generally speaking, for the nursing at the breast, we're going to use those hunger cues. And it can be 10 to 12 or more times per day if we're nursing at the breast. So definitely could be night feedings. Again, this is short-lived. It's not like you're going to be up all night for 6 months, but usually the first couple months is when, first 3 months really is when the baby's brain and body, everything's developing so much faster. So it just needs more frequency. So now let's go to the hunger cues, because that was also something I really did not know. I just thought anytime they cried, or anytime he cried, well, I have a boy and a girl, but anytime he cried, because he was my first one, that I really thought that he needed to feed. And maybe he did until he had the tongue tie revision, but previous or post revision, he still was a little fussy. And that ties in a little to his temperament. He's 7 and he's still a little fussier than my 6-year-old. She's just a little more laid back. So it is interesting that early on, you can have infants that's sort of the temperament, and you still feed on demand by these hunger cues I'm going to share. But every single time they cry does not mean they necessarily need to feed, or that your milk's not enough. Again, it's a lot of moms, I think, question, like, maybe they're latching fine and gaining weight fine, but they're still just maybe not feeling like the baby's happy or not content. That can just be the baby. That could just be the gas the baby's having. Gas is common in about 70% of all newborns. So that's a pretty high percentage. Almost 3/4 of all infants are going to have gas. And they don't know how to deal with that. Like, it's an uncomfortable feeling. So temperament and just general digestive maturity can also come into play on why your baby might act that way. So the hunger cues, though, that you want to try to look for, and this is when you'd want to start a feeding. So not when the baby's actually crying. That can be a sign that you've waited too long. But it's called the light sleep state or the early sleep state. And that is the ideal time to start a feeding. And that's when the baby kind of has these like eye movements, like it's like they're pretty much almost asleep. That's why we call it late sleep state. They're like pretty much asleep, but they're not quite in a deep sleep. So they have a very light flutter movements. And you could say the baby is like mildly alert, but it's obviously eyes are closed. The other one is called the quiet alert state. And that's when the baby's actually more active. The baby could be opening and closing their mouth. They could be, kind of, moving their head a little bit, not quite rooting. Rooting tends to be a little more of an active state, which can be maybe you waited a little too long. Again, every baby's a little different with that, but usually you want to go for the light sleep or the active alert, quiet alert, so that your baby definitely has the kind of lack of frustration, or it has the ability to be a little more patient to start the latching or even the bottle feeding, but particularly with the latching, that so then they're not like getting really frustrated when they're in this last stage, which is the active alert. And that's when you can maybe have waited too long. And that's when like the baby's like, hands in the mouth, crying, maybe kicking or like frantically, moving their arms. And you've seen babies act this way. So again, that could be gas, but likely it's probably that they're overly hungry or like overly stimulated in some other way. But trying to, again, plan ahead and trying to have the feedings be earlier. And, I used an app, which I just found helpful because I just was getting forgetful. Okay, like when did I nurse last? And he was always fussy. So I thought, I was kind of losing track of counting how many times we were nursing. So there's lots of apps where you can use, and it measures obviously the frequency. It measures how long. It measures how many diapers, which is another good way to tell if your baby's getting enough. So if the diapers, let's say the baby only had like 3 or 4 diapers a couple consecutive days, that could be a sign that the baby is not transferring the milk out of the breast. They want to usually have about 6 to 7 wet diapers and maybe 2 to 4 soiled diapers per 24 hours. So not just like 6 a.m. to 6 p.m., but that whole 24 hours, that's the diaper output that we look for. And if that's the case, and then the weight gain is going well at the pediatrician office, that's a sign that, again, the baby is getting the amount of breast milk and hydration and nutrition that the baby needs. So kind of recapping things, I know we're running out of time, is that, try to educate yourself as early on as you can. Attending today, of course, is a great way to kind of get your brain, get your body, get your mind understanding this whole breastfeeding journey. And then if possible, doing a class, there's probably other classes online now, or maybe some in person. A class is always great. Getting, the pump ahead of time if possible, so that if you do have latching issues, you have the pump available to pump and provide that in the bottle. And then lastly, really just trying to know all these different signs of when you need to troubleshoot, when you need support, well, we always do, but when you need more support, the hunger cues, and then the signs of kind of knowing if your baby's getting enough with those diapers and the growth and, kind of having more of that satisfied feeling after nursing. And we are going to go soon to the booth. If you did have some questions for me, or just anything that you have a question about regarding breastfeeding, we're going to move, I think any minute now, to the Happy Family Organics booth, where I'll still be on live and available to question and answer anything you might have. But thank you so much for today, and I really hope that you took something out of it. And please come to the booth for any questions. I know they're doing some giveaways and, just more time to learn about breastfeeding if you have the time today. So it should be any minute. But yeah, I love breastfeeding though. It's I miss it still. I mean, my daughter's 6, and we actually ended up nursing for close to 5 years, believe it or not. So I really do miss it. But you nurse as long as you're comfortable with. Usually most recommend up to a year. Some recommend up to 2 years. But whatever amount you can do is going to be beneficial for your baby.